Hi, everybody. My name is Tommy Mosier, and I'm the Student Leader Board member for the Stem Cell Transplant and Cellular Therapies Unit, otherwise known as 3JCP. Volunteers on this unit should be outgoing and ready to put themselves out there, as tasks range from stocking supplies to running errands to wiping down common areas to sitting in for the clerks, all the way down to interacting with patients and making their days just a little bit brighter. Thank you.
Hi, I'm Meredith, and I'm the SLB for the Ambulatory Surgery Center. The ASC is an outpatient surgery unit located within the Pomeranz Family Pavilion. Volunteers in the ASC work closely with the nursing staff, assisting with duties such as patient transport, providing company to patients before and after surgery, and general cleaning and restocking duties. The ASC is a fast paced surgical care unit with lots of patient interaction, so volunteers in this unit need to be self directed, able to work independently, and possess strong communication skills. The ASC is a great fit for any volunteers interested in the medical field. Shifts are available from 10 a.m. to 7 p.m., Monday through Friday.
Hey everyone, my name is Shafin Wasimi and I am the SLB for the Cancer Inpatient Unit on 4JP. This unit cares for patients who are recovering from surgery, chemotherapy, or radiation. Since patients are typically on the unit for days to weeks, volunteers have the opportunity to provide emotional support and form connections with these individuals. Additionally, volunteers will also have the opportunity to assist nursing staff with tasks such as going on walks with patients, discharging patients, and stocking. Overall, Cancer Inpatient is a great unit to develop compassion and empathy with patients.
Hi, my name is Moesha Chitlani, and I am the SLB for the Cardiology Inpatient Unit. This is a heart and vascular center focused on the recovery and long-term care of patients. Volunteers serve a critical role in assisting environmental aid and other staff members with tasks such as restocking supplies, helping with caring for patients on the unit, and occasionally transporting patients out of the unit to other areas of the hospital. Our unit provides volunteers with the opportunity to interact with patients. Thus, our unit needs volunteers to have strong interpersonal skills and to be motivated to help and be proactive to work independently. Volunteers must be able to communicate with patients, the patients' families, and with staff members. It is essential that volunteers are reliable and can make it to their shifts throughout their volunteering time. The dress code for the volunteers is the volunteer services polo, khakis, closed-toed shoes, and hours for the unit are available all 7 days of the week, 8 a.m. to 8 p.m.
At the Center for Disabilities and Development, volunteers help make the clinic a welcoming place for kids and their families. As a volunteer, you may spend your time with pediatric patients, or you may spend your time organizing exam rooms and restocking forms. There is also a chance to assist with different specialties such as psychology, audiology, speech therapy, or occupational therapy, depending on your interests.
Hi, my name is Jenna Duran, and I'm the Student Leader Board member for Child Life. Levels 9 and 10 of Stead Family Children's Hospital cares for children of all ages with various conditions. This can include cardiology, neurology, and endocrinology, but the list goes on. Child Life volunteers have the opportunity to play with patients, read to them, bring them toys, and participate in Child Life sponsored events like birthday parties and crafts. Volunteers also help to clean toys and keep the playrooms stocked and organized. Volunteers should be comfortable interacting with patients from birth to 21 years of age and have a positive yet calm attitude. This unit is open to volunteers Monday through Sunday from 9 a.m. to 7 p.m.
Hi, my name is Ella Demars, and I am the SLB for the Child Adolescent Psych Inpatient Unit. This unit treats children ages 4 through 17 with a variety of psychiatric disorders. Volunteers will have the opportunity to work with them in circle school, which is how they keep up with schoolwork during their stay. Volunteers have the chance to work closely with patients and staff and may help with school assignments, crafts and games, and participate in therapeutic recreation activities, making for a dynamic, engaging, and rewarding volunteer experience. The staff greatly depends on volunteers, which means consistent attendance is crucial.
Hi, my name is Sophia, and I am the SLB for the CVICU. The Cardiovascular Intensive Care Unit is a pre- and post-operative care unit with 24 beds. Volunteers on the unit have the opportunity to interact with patients by going on rounds, assisting with walking, and transporting patients around the hospital. As a critical care unit, a volunteer who would be a good fit for this unit is somebody with good communication skills and a friendly personality. This unit offers a good way to interact with the clinical team such as nurses, physicians, and physical therapists. The CVICU welcomes volunteers 7 days of the week from 8 a.m. to 9 p.m.
Hi, my name is Connor Wettig and I'm the SLB member for the Emergency Department. ED volunteers will have the opportunity to assist staff with various duties on the unit, while also being able to tend to patients in the ED and in the waiting room. We are the only Level 1 trauma center in the area, so this is a very unique opportunity for aspiring volunteers. With that being said, the ED staff expects aspiring volunteers to get out of their comfort zone and be willing to engage with staff and patients alike. Shifts on the ED are available Sunday through Saturday from 8 a.m. to 11 p.m.
Hi, my name is Olivia Tegger and I'm the SLB for the Geriatric Psych Unit. Patients in the Geriatric Psych Unit exhibit a wide range of neurocognitive and behavioral disorders, such as dementia, Parkinson's, and Alzheimer's. Many patients may spend prolonged periods of time on the unit, which allows volunteers to make meaningful and long-lasting connections with them. Volunteer tasks include setting up for meals, playing games with the patients, painting their nails, or just sitting and conversing with them. Volunteers for this unit should be compassionate and motivated to develop patient interaction skills. Volunteers are needed every day from 8 a.m. to 8 p.m.
Hey everyone, my name is Shafin Wasimi and I am the SLB for Guest Services Lobby Transport. In this unit, volunteers have the opportunity to take patients to their appointments via wheelchair or walk-in with them, deliver personal belongings and gifts to inpatient units, including the ones in the Children's Hospital, and assist with wayfinding throughout the hospital. Since many patients regularly show up for recurring appointments, such as dialysis, volunteers can also build meaningful relationships with these patients. This unit has one of the highest volunteer retentions and is best suited for volunteers who are sociable and outgoing.
The Medicine Specialty Unit, located on the 6th floor of the main campus hospital, is an inpatient unit that sees a wide variety of patient cases each and every day. Volunteers who are interested in this unit must be able to work independently, as well as alongside nursing staff effectively, to improve patient care experience all across the board. Volunteers are expected to do clerical duties, restocking duties, and most importantly, have patient interaction. Patient interaction generally includes playing games with patients and taking them on walks throughout the hospital, as well as entering their rooms and talking to them. If you are interested in working in an inpatient unit in the future and want to experience the true hustle and bustle of an inpatient floor, then Med Specialty is right for you.
Volunteering in the MICU, a majority of the volunteering is spent helping nurses in the unit, where volunteers will work primarily with the nursing staff, nursing assistants, and desk clerks. Tasks that are asked of for the volunteers can vary. Volunteers might be asked to do things like interact with patients and their families, help write letters for patients who have been discharged, help patients acquire various materials from the patient's library, or simply stocking the patient's rooms with linens and various PPE materials, which is greatly appreciated in the unit.
Hi everyone, my name is Tommy Mosier and I'm the SLB for the MOR and Core. The MOR, or the main operating room, is an awesome unit in the hospital that allows for tons of hands-on experience. Volunteers' primary tasks in the MOR is to assist in turnovers, and this is just cleaning up a room following a surgery and then preparing it for the next one. You also get tons of hands-on experience working with NAs and techs, helping stock. We do have a requirement to have 36 hours of volunteering outside of the MOR before joining the MOR. On the other hand, the Core is a subunit of the MOR, which is found inside of the MOR. The Core is what deals with stocking supplies for surgeries. So in the Core, volunteers' primary task is to prep all of the items needed for a surgery. And because of that, it's a little bit more straightforward, and we do allow new volunteers to volunteer in the Core. After you have 36 hours of experience, you can then join the MOR. Thank you.
Hey everyone, this is Kadeed Patel. I'm the SLB for Main Operating Room, Second Stage Recovery, and Electroconvulsive Therapy Unit. So our unit is split up into two parts. In Second Stage Recovery, volunteers will help patients after surgery by assisting the nursing staff with transporting patients, offering them food and drinks, and keeping the rooms clean and stocked. In the ECT, volunteers will assist psychiatric patients in recovering by helping with repositioning, maintaining a clean environment between patients, and providing essential support that contributes to patients' comfort. Volunteers should have good communication skills be able to work independently, and take initiative.
The Mother-Baby Care Unit, or MBCU, is a unit that cares for mothers and their newborn infants, and our mother-baby volunteers interact with those patients. Mother-baby care volunteers have the opportunity to hold babies, interact with the new and expectant mothers, and assist nursing staff with caring for patients on the unit. Additionally, volunteers may occasionally help in labor and delivery. General tasks on this unit may look like assisting mothers by getting them water, calming and cuddling infants, helping stock the unit, and assisting with unit-based projects. Volunteers should be self-motivated and ready to help. In the Neuroscience Intermediate Inpatient Unit, or NIIU, volunteers assist staff with functional inpatient support. Some typical volunteer duties in the unit include visiting with patients, assisting the nursing staff with patient bathing, escorting patients to different areas of the unit and hospital, unit deliveries, clerical work, and cleaning. Additionally, volunteers should be comfortable with lots of patient interaction and staying self-motivated to complete tasks on the unit.
Hi everybody, my name is Mia and I am the SLB for Clerk and Sibling Support Program in the NICU. The Neonatal Intensive Care Unit, or NICU, is a unit that cares for premature infants, and our CSS volunteers help out there. Clerk and Sibling Support volunteers assist the nurses and unit clerks at the front desk in answering phones and screening visitors. They also work with child life staff to interact and play with NICU siblings and assist with the NICU Books to Babies program. It is a perfect way to get your foot in the door if you hope to become a developmental care volunteer. Hi everybody, my name is Mia and I am the SLB for the Developmental Care Program in the NICU. The Neonatal Intensive Care Unit, or the NICU, is a unit that cares for premature infants, and our developmental care volunteers interact with those patients. Developmental care volunteers have the opportunity to hold babies, read to them, talk and play with them, and assist nursing staff with caring for these infants. These interactions provide positive touch and comfort that aid in the development of these patients. Volunteers interested in developmental care must have a minimum of 40 volunteer hours at UIHC and must also be 18 years or older.
The Orthopedic Trauma Spine Unit is a great unit for volunteers who are seeking a fast-paced environment where they can see a wide variety of medical and surgical patient populations. In the unit, the volunteers will work closely with the nursing staff to care for the patients on the floor. There's also a big focus on rehabilitation in the unit. So volunteers at OTS will be able to work more with physical therapists than they would in another unit in the hospital.
Hi, my name is Sophia and I'm the SLB for the PSC. The Pediatric Specialty Clinic is where kids come to the Stead Family Children's Hospital to be seen by a variety of specialists or for regular appointments. Volunteers on the unit will primarily interact with patients and their siblings while in the waiting room, playing with them in the playroom, or helping the child life specialist with tasks like cleaning the toys and maintaining the playroom. A volunteer who would be a good fit for this unit is somebody who likes kids or wants to work with them in the future and has a friendly personality to help distract them from getting nervous about appointments. The PSC welcomes volunteers Monday through Friday from 9 a.m. to 3 p.m.
The Pediatric Ophthalmology Unit welcomes volunteers with over 30 hours of experience. In this unit, volunteers get to assist physicians directly. This means helping out with exams, escorting patients to and from appointments, and cleaning the rooms once the appointment is done. The work you do in this unit really depends on which physician you are with, which can be an optometrist or an ophthalmologist, providing a variety of different tasks for you during your shift.
Hi, my name is Connor Wettig and I am the SLB member for the Pediatric Intensive Care Unit. The PICU is a unit that provides inpatient care to critically ill or injured infants, children, and teenagers. Volunteers in this unit can interact with patients by providing diversionary play to patients and siblings, giving families a tour of the unit, and cleaning and organizing playroom toys. Volunteers can also help with the organization and distribution of the Ronald McDonald House family room supplies in the hospital. The PICU is best suited for dependable, outgoing volunteers who are comfortable with pediatric patients. Shifts are available Monday through Friday from 9 a.m. to 4:30 p.m. Shifts on the weekends may vary.
Hi, my name is Olivia Tegger and I'm the SLB for the Palliative Care Unit. The patient population seen by the Palliative Care team is very diverse. Patients may be nearing the end of recovery and headed home soon, or they may be entering the final stages of their life. The main volunteer task of the unit is providing companionship and support for these patients. This companionship may be sitting and conversing with the patient, retrieving books from the library for them to read during their stay, or just being a friendly presence in the room during times of loneliness. Volunteers for this unit should be comfortable with patient interaction and empathetic. Volunteers are needed every day of the week from 8 a.m. to 7 p.m.
Hi, my name is Ella DeMars, and I'm the SLB for the Children's and Patients Libraries. The libraries offer a wide range of entertainment options to support patients and families during their hospital stay. These resources include books, movies, laptops, video games, and craft kits made by the volunteers. As a volunteer, you get to help deliver these items throughout the hospital, helping to brighten the day of patients and families. The Children's and Patients Libraries are separate, but both welcome volunteers from 9 to 4 Monday through Friday, as well as the Patients Library from 1 to 4 on Saturday and the Children's Library from 1 to 4 on Sunday.
In choosing to volunteer for radiology, there are 3 different units to volunteer in: CT, MRI, and breast imaging. While each of these units have their own unique duties, general duties include greeting and welcoming patients, guiding them through necessary parts of their visit, as well as working alongside hospital staff to clean machines and keep patient turnover at a consistent rate. Volunteers here must be able to work independently as well as alongside staff in order to keep patient experience at an all-time high. Volunteers will also receive training on how to use various radiology equipment, such as the MRI machines. Now, if you are interested in the radiation sciences, this is the perfect place for you. But if you're not, it's quite all right to volunteer here as well.
Hello everyone, my name is Jenna Duran and I'm the Student Leader Board member for the Respiratory Specialty and Comprehensive Care Unit. On our unit, volunteers have the opportunity to work closely with patients, offering a listening ear and making sure that they are comfortable and have what they need during their stay. They might also be asked to talk, read, entertain, and play with their patients. They also might be asked to do paperwork, restock items, run lab work to the floor, and run errands to pick up or drop off supplies. Shifts are offered from 7 a.m. to 7 p.m. 7 days a week.
Hi, I'm Meredith, and I'm the SLB for the Stead Family Children's Hospital Surgery Prep and Recovery Unit. This unit allows volunteers to provide support to pediatric patients and their families on the day of surgery. Surgery Prep and Recovery volunteers work closely with the nursing staff and aid in discharging and transporting patients, providing entertainment for children and siblings waiting for surgery, cleaning and preparing patient rooms, as well as any additional tasks to improve the patient experience. Volunteers in this unit should be interested in working with the pediatric population, demonstrate good communication skills, and be independent and driven. Shifts are available from 9 a.m. to 4:30 p.m. Monday through Friday. The Stead Family Children's Hospital Sedation Prep and Recovery Unit is a small, close-knit unit where volunteers provide support to patients and their families as they prepare for imaging and procedures. Volunteers work closely with the nursing staff and aid in discharging and transporting patients, providing activities for children and siblings, cleaning and preparing patient rooms, and various other tasks that make patients and their families more comfortable. Volunteers may also observe a procedure while volunteering after having earned over 20 hours of service in the unit. This unit is great for volunteers who have a passion for pediatrics, can communicate well with children and their families, and are motivated and independent. Shifts are available from 9 a.m. to 4:30 p.m. Monday through Friday.
Hey everyone, I'm Kadeep Patel, the SLB for Surgical and Neuroscience Intensive Care Unit. In the SNICU, volunteers play an important role by assisting nursing staff with transporting patients, restocking supplies, and sometimes even observing minor procedures. The pace in this unit can vary greatly. Some days are busy with lots of activities and other days are slower. This gives volunteers an opportunity to be self-motivated, take initiative, and seek out ways to contribute meaningfully to the team. Volunteers in this unit need to be outgoing, confident, and ready to step in whenever help is needed. This means helping the staff directly or finding ways to support unit during quieter times.
The Surgical Specialty Services Unit, or also known as 2RC, is a fast-paced, hands-on unit where volunteers really get to make an impact. You'll support both the patients and the staff by helping with basic care, walking with patients, and stocking supplies. It's a great fit if you're outgoing, dependable, and looking to build confidence in a hospital setting while gaining experience.
Hi, my name is Moesha Chitlani, and I am the SLB for the Women's Health Inpatient Unit. This unit focuses on a variety of gynecologic and postpartum care and newborn services. Volunteers will help patients on the unit of various age groups by performing tasks such as restocking rooms, assisting patients with basic needs, discharging patients, making breast pump kits, and maintaining general order of the unit. Occasionally, volunteers will help nursing assistants with providing newborn care. This unit needs volunteers who have strong interpersonal skills and are motivated to work independently. There's also a lot of opportunities to observe medical procedures and shadow staff on the unit over time. Shifts are available Monday through Friday, 7:30 a.m. to 5 p.m., and Sundays 10 a.m. to 5 p.m.